Dr. Malkin, what happens if my dental implant fails?
So just to make sure everyone understands that the dental implants are very successful. It's one of the most successful procedures in dentistry, and the success rate is more than 90% consistently. However, the implants do fail, and there could be complications as in any medical procedure or surgical procedure. If the implant fails, what happens, it fails to fuse to the bone, what we call osseointegration to the bone. So when this fails, instead of fusing to the bone and be able to accept chewing forces that comes from placing an implant, placing crown or a bridge over the implant gets encapsulated by a fiber and is loose, so we have to remove it. So when that happens, we can remove the implant, clean the area really well, graft it with bone, and then come back in 3 to 4 months to place a new implant. One thing to make sure is that we need to understand why the implant failed. We have to make sure that the failure of this implant doesn't have to do with the medical condition of the patient. For example, if the patient has uncontrolled diabetes, or perhaps the hygiene was really inadequate around the implants. So before we go and replace the implant, which can be a very predictable procedure, we just have to make sure that those factors that can compromise the implant healing are not there for the next go around.